Welcome back to Grandma Needs Rehab. And in this episode, we talk about that thing, broken heart syndrome. So, is it true that you can die from a broken heart? And the answer is unfortunately yes. Not so much metaphorically, but yeah, literally. So, if that interests or terrifies you, then stay tuned and we'll ponder that. So, what in the world is broken heart syndrome? It's this thing, Takotsubo Cardiomyopathy. And after, you know, reading that, you can understand why we call it broken heart syndrome. It's just, yeah, easier to spell, easier to understand for the most part. But what exactly is it? Takotsubo's cardiomyopathy or broken heart syndrome is a temporary condition where severe emotional or physical or a combination of both stresses affect the heart in a way that is usually temporary, but at the same time, it affects how the heart actually pumps. What does that mean? Well, that just means you're under so much physical or emotional stress that the hormones inside your body basically make your heart not squeeze properly. And it's very specific, and it's something that we unfortunately see on a more often than regular basis in the hospital. And we just need to explain a little bit about what it is. Broken heart syndrome is kind of identified by three major characteristics. And the first one is it's temporary. As compared to other forms of heart failure and heart issues, this one often can be self-limited. In other words, it can get better on its own in about 6 months, assuming we can kind of deal with all the complications associated with between the time you develop it and the time that it starts to resolve on its own. And there can be a bunch of complications that we'll talk about in a little bit as to what they are and how we deal with them. But second one, stress hormones. So this is actually caused by emotional or physical stress. And interesting, the hormones involved with stress, the stress hormones, if you will, epinephrine and norepinephrine, the kind of hormones that get spit out from your adrenal glands if you were like being mugged, or something to that effect. Kind of the flight or fight mechanisms or hormones. So those hormones during these severe episodes of stress are dumped into the system, like large amounts of them, and for prolonged periods of time. And we actually know that's what ends up leading to the overall changes in the heart. And these are physical changes. These are changes that we can like physically see on an ultrasound that tell us, hey, this is probably broken heart syndrome. The other or third part of this is the fact that it often presents as a typical heart attack or congestive heart failure. So when you look at somebody that comes into the emergency room that's having chest pain and they have chest x-ray signs of heart failure or their heart numbers are elevated concerning for a heart attack, that's very consistent with broken heart syndrome. And it can be very difficult, at least when they get admitted, to see exactly what it is. It's usually over the process of evaluating these people in the hospital that we find out that it's broken heart syndrome. And for all those who are interested about heart failure and heart attacks and kind of how they present and everything, you can look at some of my other videos on those subjects in particular. When a person comes to the emergency room, it's usually because of one of three things, and very well could be a combination of. When they have broken heart syndrome, it's actually a form of heart failure usually. So people come in with heart failure symptoms, which tend to be things like chest pain. Their heart is not squeezing very well. The fluid gets backed up and it gets backed up into their lungs, which is what heart failure is. And they get shortness of breath. Usually their oxygen levels are low. And in addition to that, they may have swelling of their legs, depending on how long it took to develop these symptoms. Some of these, the swelling in the fluid that's in their lungs because of gravity, some of that swelling can get pulled down to their ankles. They can get swollen legs. But the things that bring people into the emergency room with this type of syndrome are going to be symptoms of heart failure: chest pain, shortness of breath, swelling or edema of the lower extremities. Many times these are all very new symptoms for this person. So when they come into the emergency room and they're having symptoms, as we talked about a second ago, we normally do a couple things. And we tend to do this with all people that are having chest pain and shortness of breath, but these things actually help us determine whether or not this is broken heart syndrome versus a heart attack versus regular or traditional heart failure or even something else. So first thing we do is a chest x-ray, and the chest x-ray often shows fluid because, again, it's a type of heart failure. Heart failure involves fluid getting backed up into the lungs, and because of that, we can see it on a chest x-ray. Often these people, again, short of breath, low oxygen levels. We do an EKG. The EKG is important because if you're in heart failure, we need to know, is this because you're having a heart attack or not? Many times, people with broken heart syndrome are having chest pain. So are they having chest pain because they're having a heart attack? The EKG helps us with that. Usually the EKG does not show signs of a traditional or regular heart attack, if you will. But some of the blood work may show that their heart enzymes are elevated. Just like in a heart attack, if there's damage to your heart, the proteins in your heart, because your heart muscle is damaged, those proteins leak into your bloodstream. We can then draw blood and capture and look at those proteins. And as your proteins climb higher and higher, that means that there's more and more muscle damage. So many times your blood work with broken heart syndrome will show an elevated number. It'll show that your heart is at least under stress, if not actually doing significant amounts of damage. We can see that the heart is definitely under stress. Those numbers tend to be elevated. And then, of course, we end up doing an echo or an ultrasound. And this is the thing that really helps us determine what type of problem we're having. The changes on an echocardiogram actually are what tell us whether or not this could be broken heart syndrome or Takotsubo cardiomyopathy. So while these things are very, very important, it's the echo that usually tells us what we're dealing with. I realize these look like some freakish thing from Among Us, but they're actually supposed to represent kind of heart changes. And these are obviously, not to scale, nor are they particularly accurate for that reason. But at the same time, my hope is that they kind of convey something. And the first one is what we consider kind of a normal looking thing on ultrasound. Now, this is not actually what it looks like on an echo, but when you do an ultrasound of the heart, you're looking for the top part of the heart, which is the atrium, and then the bottom part, which is the pumping part, which is the ventricle. And this part squeezes kind of all together. And the reason that's important is because when your heart is normally squeezing, we can see on an ultrasound that all parts of the wall of the ventricle are squeezing together and appropriately, which is a little bit different when you have a heart attack. For example, this part may not be squeezing much at all. It may just be squeezing a little bit, while the other parts of the ventricle are squeezing harder. For example, if that part of the wall is squeezing very hard and this part is not squeezing very well at all, that could be telling us that this part of the heart is not getting enough blood flow. For example, during a heart attack, this wall may not be squeezing properly. If it were damaged in a heart attack and had scar tissue, it might not be squeezing at all in certain areas. But that can help us see where there's a problem. And then we can kind of go after it. Takotsubo cardiomyopathy or broken heart syndrome is a little bit different in the sense that the atrium, or the top part of the heart, still looks pretty much the same. The bottom part, however, looks very, very different, as you can see by this ugly rendition of whatever an echo is supposed to look like. What happens is your ventricle is squeezing just like it is over here. However, the bottom part of your heart, not only is it not squeezing properly, but it actually tends to balloon outward. As you can see, again, not to scale by any means, but this area is dilated and kind of stretched out compared to what you would otherwise see in an ultrasound. And this ballooning, which we call apical ballooning, because this part of the bottom part of your heart is called the apex. If this balloons out, it's called apical ballooning. And that is one of the signs of this Takotsubo cardiomyopathy, or broken heart syndrome. And we can see it physically moving. For example, these walls are physically squeezing. We can see it on ultrasound, but this area down here, this ballooned part, is not squeezing appropriately. And again, that's really what gives us the diagnosis. It's been shown that the high stress hormones, the epinephrine and norepinephrine that we talked about before, that's actually what's responsible for this ballooning. It actually, the high levels of these stress hormones actually change the structure of your heart. They actually change how your heart pumps, particularly in that area. So the cause of this is still the stress hormones, but it's the stress hormones that lead to the bottom or the apical part of your heart not squeezing properly. That unfortunately leads to the heart not pumping efficiently, which then causes chest pain and unfortunately heart failure, which then brings people to the emergency room. But it's the stress hormones themselves that actually cause physical changes in the heart structure itself. The good news about that, if there is such thing about good news for heart failure and such, is that over the course of 6 months usually, if we treat the complications associated with that, these changes of the heart actually reverse and they will go back to what your normal left ventricular squeezing is supposed to be. We just have to get you to that point first. The main complications we see in heart failure in general, but especially with Takotsubo or cardiomyopathy or broken heart syndrome, are heart failure, because it is a form of heart failure, and cardiac arrhythmias. So heart failure, you know, unfortunately, you can die from heart failure, which is when can people die from broken heart syndrome? And the answer is yes. It's usually because of one of those two issues. One is heart failure, which, the heart fails to pump properly, and then the fluid backs up into the lungs. The lungs, because they're not able to get oxygen appropriately, people develop what we call hypoxia or low oxygen levels in their bloodstream, which puts more of a stress on their heart or their kidneys and things like that. So heart failure, you can absolutely die from heart failure. And sadly, we see that on a regular basis. The thing about heart failure is when we treat this cardiomyopathy, we're actually treating the complications associated with it. In other words, when we put people on medication for Takotsubo cardiomyopathy, we're actually putting them on medications to deal with the complications of, for example, we put them on medicines to make their heart failure better, which include medicines to try and get the heart to squeeze better, but it's primarily things like diuretics, where we pee off some of the extra fluid that's in the lungs and then people get better. When we have cardiac arrhythmias, which are basically an abnormal heart rhythm, and many of them unfortunately can be life-threatening, these cardiac arrhythmias also need to be treated. Sometimes it can cause your heart to be too fast. Sometimes it can cause your heart to be too slow. Sometimes it can put your heart into an irregular rhythm that you cannot physically pump your heart because of the abnormal shaking of the heart, or what we call ventricular tachycardia, ventricular fibrillation, all the big bad words that basically are a nice way of saying that you can die from an irregular heartbeat or an irregular heart rhythm. And these two things, if we can treat them as complications over the course of the next 6 months, many times that heart, the structure will go back to its normal or significantly improve, and then these two things don't become much of an issue anymore. Is there one group that seems to be more at risk than others for broken heart syndrome? The answer is yes, elderly women. And why is that, you might ask? Well, a lot of studies have actually shown that women that are postmenopausal tend to have an increased risk of this cardiomyopathy. Not 100% sure why. I mean, not that I'm 100% sure why, but science in general, not 100% sure why. But we have shown that estrogen deficiency, which is a lot of these elderly females that are postmenopausal, estrogen deficient, have an increased risk for this type of cardiomyopathy. So the prototypical person that often comes to the emergency room is an elderly female that's postmenopausal that had a massive emotional trauma. Usually the loss of a spouse actually is probably what we see the most. What usually brings her to the emergency room is the symptoms of the heart failure: chest pain, shortness of breath, swelling, combination of all of those above. So then many people then ask, well, does giving people estrogen when they're elderly, does that decrease your risk of cardiomyopathy? And most of the studies that I've read so far haven't really shown to be necessarily helpful. The other aspect of that is the emotional stress. So if we treat these people for their emotional stress, having them see therapists, having them on medications for things like that and depression, does that make a huge difference as far as preventing that? And the answer is unfortunately also no. And a lot of that has to do with the fact that this is such a significant trauma. A lot of the people that we see in the hospital are already being treated. They're already seeing a therapist. They're already seeing a psychiatrist. They're already on medications. But this is such an emotional disaster for them that, the medication that we give them to help with depression is not fixing the hormone dump that they get from the loss of a partner from 50 years. So the benefit, if there was such a thing, is the fact that once we get them through that stage, treating the complications, et cetera, getting them through the heart failure, many times at 6 months, those heart changes on echo actually, get better, if not completely resolve. So for all those that are super interested in grandma, well, she obviously didn't die from broken heart syndrome, but the issue is, can you? And the answer to that, unfortunately, is yes. Grandma, she just needed treatment for heart failure and a little bit of rehab to get stronger so she can come back. And, with a little bit of medication and a lot of support, my hope is obviously grandma will be, making her little pumpkin pie thingies in no time, probably 6 months. But if you like this type of content where we sit and talk about some of the stuff, even if it's a little unusual or things that you may not have heard before, just like, comment, subscribe, do all the things. And by the time she gets home, I'll hopefully get you another video.